We're making this video to give you an explanation of why we are asking another doctor to take a look at the eyes because of some damage that diabetes has done to your eyes. And why in the world would diabetes be in my eye? Well, basically diabetes is a blood disease, and there are lots and lots of blood vessels in your eye. Diabetes is in the adrenal glands, and what it does is it causes the adrenal gland to secrete sugar into your body. However, when it's doing this, it's doing it more than it should. It's sending out an abundance of sugar throughout that. And and that's because of the too much sugar that we have been bringing into our body. So in diabetes, this is continually sent throughout your body, and that's where the damage is done as it affects various parts of the body. Now, in diabetes, your blood vessel walls are very weak, and so the insulin running through the veins more than it is what causes this weakness. Now, nicotine even makes it worse, so if you happen to be a smoker, you must immediately stop. Or you are looking at a strong possibility that you will absolutely go blind. I have personally witnessed this with one of my patients who is a smoker who also had diabetes, and yes, I actually watched as the blood vessel inside the main artery in her eye just popped, and blood just flowed into the eye, and from that moment, and it happened to go into both eyes, and from that moment she was blind. So that's a very good reason that you should be watching your diet, exercising, which you already know about, so this is prevented. Now, why does the family doctor want us to look inside your eyes? Well, the kidney has blood vessels that are approximately the same size as your eye. And one of the functions of your kidney is to function this material and the insulin and such that goes through. And again, the same damage can happen in the kidney. So what they are assuming is, since the blood vessels are the same both in the eye and in the kidney, that what we see when we look into the eye is probably going on in the kidney. Now, we are also concerned about your eyes, of course. And when there's a break in the blood vessel in your eye, what it does, it forms a little bit of a scar, and that pulls on the tissue, and you have enough of them that can pull and damage the part of the eye called the retina, which is the nerves with which you see. And if it happens to be in the right place of the eye where you see sharply 20/20, you could go blind from this and actually lose the retina itself if it were not taken care of. And so what we're going to do is refer you to a doctor who specializes on the eye and the damage that diabetes does to it. And what they'll do, they'll bring you into the office, they'll take a look inside the eye, and certainly they will dilate your pupil. And what they'll do is take a laser and literally cauterize areas of the eye where the damage is to stop it from spreading. This will be a very concise type of a movement in trying not to damage other areas that are healthy within the eye. You'll need to take somebody with you, as there will be the sensations will last about 2 hours after the period of time you're in there, and you could be seeing lights in kind of a grayish area, and it eventually will go away and it will return to normal, but you'll need some assistance there. Also, your eyes will be dilated, and so you'll need to take care of from the sun. And after all this is done, your doctor will send us a report.